Housing is a human right. We're going to talk about another right that we need, a human right, is access to health care, good quality health care, and making sure we do everything we can to keep people in our state healthy. The next person that we're going to hear from today is Chris Wade with the AIDS Foundation of Chicago.
Thank you, thank you. My name is Chris Wade, and I'm a representative of Illinois Alliance for Sound AIDS Policy. I have been a person living with HIV for 20 years. I am a recovering alcoholic addict. I also wanted to inform you that it was because of substance abuse treatment that I got myself into care. Had it not been for substance abuse treatment, which linked me into medical care, which then linked me into housing, which then provided for the fact that I was able to eat, had a refrigerator to put my medications in, kept me sober. Had it not been for those services, I wouldn't be here today. I am actually wanting to compare that situation to a three-legged stool. If you remove one of those legs, that stool's no good to you, is it? We need all mechanisms of human care to make this system work for everybody. That's what it's all about. Today we're here to support each other and rally for basic human care, such as education, human services, health care, housing, and nutrition. HIV services is also one of those basic human needs. If we cut HIV services, we're going to see an increase in HIV cases throughout Illinois. We also know how this impact will occur on communities of color, which currently bear 70% of all new HIV infections across the state. Currently, Governor Pat Quinn has proposed a budget for 2014 that would reduce funding in HIV/AIDS services from $26 million to $21 million. That's a 16% cut. Since 2011, Illinois has been cutting HIV funding by $9 million, or 30%, over the past 3 years. HIV is a communicable, yet chronic disease. People are living healthier, quality lives. However, we are currently at a cusp of having the tools to prevent this epidemic. We are right there on the cutting edge. When HIV positive receive treatment, they reduce the likelihood of transmission of HIV to others by approximately 90%. Jeopardizing HIV/AIDS funds and programs and supportive services like housing, healthcare, and education will not help us achieve a goal of getting to zero. In fact, cuts mean a huge gap in the Illinois budget, and as more people living with AIDS will end up in the emergency room. We all know that the Illinois budget is under great stress, but over the last few years, human care services have suffered disproportionately. These services are a vital part of our community, a vital part of our state, a vital part of our neighborhood. I stand with all of you today asking you to ask your elected officials in this building to do the right thing. Fix our fiscal house, and it's going to require a commitment from all of us. However, I urge you to lift your voice and urge state leaders to do the right thing and stand behind human care. Thank you.